Hey, good optometry morning. So this is Sir Elton John, and this is an eye infection, and this is not being able to see, and this is everyone talking about what happened to Elton John's vision. And All right, so let me catch you up on the full backstory with Elton John and his vision. So in September 24, Elton John released this Instagram. In this Instagram, he said, "In the summer, I've been dealing with a severe eye infection that has unfortunately left me with only limited vision in one eye. And it's healing slowly, but it's taking some time for the vision to return to my impacted eye." Then in November, on Good Morning America, so in that interview, he said he lost vision in his right eye in July in the south of France, and it's been about 4 months since he's been able to see out of that eye, and that his left eye's not the greatest either. And he said he couldn't read, he couldn't see anything, he couldn't watch anything. Then a few days later, at some remarks after the premiere of Devil Wears Prada, he mentioned that he also mentioned his vision loss. Basically he said he couldn't watch the previews, he couldn't see the show very well, he heard it and he liked what he heard, but he wasn't able to enjoy it because of his eyesight and not being able to see. So here's a question that everyone, including eye doctors and all my eye doctor chat groups, they're wondering, okay, what type of eye infection did Sir Elton John have? So let's talk through the options that he might have had. So when most of you have an eye infection, and most of the time if you think of an eye infection, you're thinking of something called a bacterial or a viral conjunctivitis, which is an infection of the tissue on top of the white part of your eye, but it doesn't affect the cornea, the clear tissue on the front of the eye. And conjunctivitis is going to give you symptoms of a red, puffy, inflamed eye that often will have some type of discharge. Now, these type of infections very, very rarely affect your vision because they don't affect the cornea. So it's not going to be one of these garden variety types of conjunctivitis, but there is a type of infection called a keratitis, which is an infection of the cornea, which is the clear tissue on the front of the eye, which can result in vision loss. Now, these infections can be a result of all sorts of pathogens, including bacteria, viruses, amoeba, fungi, all sorts of things that can attack that tissue and damage it and cause reduced vision. So these are much more serious infections. If it's a bacteria, one of the most serious bacteria infections is something called Pseudomonas. And so this is an organism that's all over in our environment. And so if you get a scratch on the cornea and you get Pseudomonas bacteria that starts attacking the cornea, that can result in some severe vision loss. Another nasty organism is Acanthamoeba, which is an amoeba that lives in freshwater lakes and rivers, and that, if you have a scratch on your cornea, and if that gets in attacking your cornea, that can result in really severe vision loss very, very quickly. Both of these are very serious problems for contact lens wearers that swim in their contact lenses. Now, you could also have fungus that's out there. This is common if you have any vegetative type of injury, like a tree branch that hits you on your eye. You could be exposed to a fungus that can cause some serious eye infections. And it can also be due to viruses. And probably the two most common viruses are ones you've heard of. One is called shingles, and one is the one that causes cold sores, which is a herpes virus. Both of these viruses can attack the cornea, and if they do, they can result in vision loss. So you also could have infections that affect the retina. So there's all sorts of bacteria and viruses that can affect the retina and cause damage to that. There's one called cytomegalovirus retinitis, which is a viral infection of the retina. But you can also have all sorts of other types of infections that are associated with maybe people that are immune compromised or have some type of systemic condition that could affect the retina. And there is also an infection of the eye called endophthalmitis, which is a very serious bacterial infection inside the eyeball, which can happen after surgery or a very serious injury, which can definitely result in vision loss. So the speculation is Elton John could have had any one of these infections. However, almost all of these, with the exception of very rare cases, are unilateral conditions. They're only affecting one eye. So if they're going to affect his one eye and not the other one, he's still going to have the other one to see, and he typically wouldn't be saying that I can't see, I can't function, because he would have sight in one eye. So if I want to think of eye infections that are going to affect both eyes at the same time, there's not many of them, and they're pretty rare and unusual if that's going to happen. However, there are some types of inflammations which are different than infections that could cause bilateral reduction in vision. And sometimes eye doctors will describe something as an infection instead of an inflammation because it's a little bit easier for patients to understand. And probably the most common one, although it's still rather rare, is something called temporal arteritis or giant cell arteritis, which is an inflammation of some of the blood vessels that supply the eye. And that definitely can cause reduced vision in one and or both eyes rather quickly. But I think I found the answer, because after listening to some of the clips a little bit more carefully, Elton John actually didn't ever say that he had an eye infection that affected both eyes. He only said that he had an eye infection that severely infected the vision in his right eye. So it may be a possibility that Elton John actually had poor vision in his left eye even before this infection. So the most common condition that could cause that is something called amblyopia. And amblyopia, otherwise known as lazy eye, is a condition that affects probably about 2 to 3% of the population. So it's actually relatively quite common. And it can result in reduced vision in one eye that you just don't see very well. And people that have amblyopia, they're basically just relying on the vision from one eye. And if that one good eye is affected with some type of injury or infection or a problem, their vision can be severely impaired because they don't have a backup eye to allow them to see clearer. Which of these Sir Elton John has, I'm not really sure. But the one thing I want to say, and this is coming from someone who has some vision conditions that have affected the vision in one of my eyes or the other eye at various times of my life, I want to commend Sir Elton John for his bravery on sharing his vision impairment with everyone else. Because vision impairments can be one of the most difficult things for people to deal with. This is because vision impairments are invisible. People, including Elton John, they look normal when they have vision impairment. It's an invisible impairment. And that makes it hard because people assume that you're doing well when you might be really struggling. And the second reason that it's hard to share about vision impairments is because most of the public don't understand vision impairments. Most people say, when I don't have vision in my eyes, or I don't have vision, like Sir Elton John said, they assume he has zero vision at all. And then they're a little bit confused because he said, I can't read, I can't watch stuff, I can't look at lyrics, but then he's walking around not bumping into things, not using a white cane, all that type of stuff, and it doesn't make sense to people. So the thing with vision, it's very, very rare that someone has absolutely no vision. You usually have some part of your vision, but you can have parts that can make things much more difficultly. So if you have a condition that affects your central vision, you may have a very difficult time in recognizing faces or reading print or looking at details, but you can walk around a room and even someplace that's completely unfamiliar to you and never bump into anything at all. Or if you have a condition like glaucoma where it affects your side vision but not your central vision, you can read the smallest detail on a prescription bottle, but if you're walking around even your own home, you might be bumping into chairs and things like that just because you have trouble seeing the details. One piece of advice I can give for everyone that has any type of vision impairment is take some tips from Sir Elton John and share what your vision impairment with other people so they can understand what you may have trouble with and what you may not have trouble with. And with that, I want to wish Sir Elton John the very best and have a great optometry.